Turning now to tonight's medical rounds. He's a nationally recognized expert in the field of cardiology with a special interest in athletes with cardiac issues. He'll be speaking at Glastonbury High School tomorrow night, but tonight we want to congratulate Dr. Paul Thompson on his new appointment as co-physician-in-chief for Hartford Healthcare's Heart and Vascular Institute. Good evening, Dr. Thompson. Thank you very much for joining us tonight. I hope they can fit that all on a business card for you. That's fantastic. Well, let me ask you first and foremost, we hear a lot about athletes having cardiac problems during exercise. Should parents be worried about this?
Well, each one of these events is a tragedy, and we hear a lot about them in the media, but parents really should not be that worried about such events occurring because they're actually quite rare. If you look at the United States, there's well under 100 of these events per year. Now, as I want to stress, every single one is a tragedy for the athlete, but for the family, for the team, for the town, because we're also involved in athletics. But parents should really not make, of all the things parents have to worry about, this is not one of the top on their list.
Well, you know, Doctor, some advocate doing certain tests, as you know, on all athletes to prevent sudden death. What's your take on that issue?
So the idea of doing electrocardiograms, or what we call ECGs, on all athletes is really a big source of controversy. Now, I was part of the American Heart Association, American College of Cardiology consensus guideline group, and we advocated against doing them routinely. Now, if there's some other reason to get an EKG on your athlete or on your child, then go ahead and do it. But simply to participate in sports, we don't think it's worthwhile. Why? Because the event rate is so low that we actually find many more false positive abnormalities than we actually find problems.
Well, I'm sure you know parents worry. What should parents be worried about specifically when it comes to their athletic children?
Well, first of all, I think they need to relax. But if a child has some new symptoms, in other words, they can't keep up with their exercise level that they did before, or shortness of breath during exercise, or passing out during exercise, primarily symptoms. So if a child has symptoms during exercise or in association with their sporting event, then they ought to pay attention and make sure that person is seen by someone, the child is seen by a physician.
Well, as we mentioned, Doctor, you'll be speaking at Glastonbury High School tomorrow night. Can you give us a preview right now of what you'll be talking about?
So I actually call this everything you couldn't afford to ask your sports cardiologist. And what we actually do in these sessions is I take questions from the audience and then try to organize them into a talk. So it's not a lecture. You won't be lectured at. You've probably had enough of that in school. But it will be a discussion of some of the issues that parents and kids are concerned about.
Well, it's good to know, and we certainly appreciate you joining us right now. I can imagine you probably brought a little peace of mind to a lot of parents out there. So, Dr. Thompson, thank you very much.